Question 1. Alprazolam medication is used to treat which of the following? A. Anxiety. B. Bipolar disorder. C. Depression. D. Psychosis. Correct answer, A. Anxiety. Alprazolam is a benzodiazepine medication primarily used to treat anxiety disorders, including generalized anxiety disorder and panic disorder. It works by enhancing the effect of GABA, the brain's main inhibitory neurotransmitter, which helps reduce feelings of anxiety and promote relaxation. Question 2. A patient is prescribed imipramine for the treatment of depression. Which of the following potentially lethal side effects should the nurse educate the patient about? A. Congestive heart failure. B. Guillain-Barré syndrome. C. Hyperglycemia. D. Seizures. Correct answer? D. Seizures. Imipramine is a tricyclic antidepressant, TCA, and like other TCAs, it can have a variety of side effects, some of which can be serious or even lethal. One of the potentially lethal side effects of imipramine is seizures, particularly at higher doses or in the case of overdose. TCAs lower the seizure threshold, increasing the risk of seizures. Question 3. A patient was recently prescribed phenelzine. The patient is taking several other medications for chronic conditions. The nurse should be alert for which of the following potential complications? A. Blurry vision. B. Excessive secretions. C. Hypertensive crisis. D. Rhabdomyolysis. Correct answer, C. Hypertensive crisis. Phenelzine is a monoamine oxidase inhibitor, MAOI, used in the treatment of depression. MAOIs have a significant risk of causing a hypertensive crisis when taken in combination with certain foods or medications that contain tyramine, such as aged cheeses, cured meats, and fermented foods. Additionally, certain medications, such as sympathomimetics or other hypertensive drugs, can increase the risk. A hypertensive crisis is a potentially life-threatening condition marked by a sudden and severe increase in blood pressure. Question 4. A patient has been prescribed phenelzine for the treatment of depression. Which common side effect should the nurse instruct the patient about? A. Arrhythmias. B. Diarrhea and incontinence. C. Excessive salivation and tears. D. Orthostatic hypotension and dizziness. Correct answer. Orthostatic hypotension and dizziness. Phenelzine is a monoamine oxidase inhibitor, MAOI, commonly used to treat depression. One of the most common side effects of MAOIs, including phenelzine, is orthostatic hypotension, which is a drop in blood pressure when standing up, leading to dizziness. This occurs because MAOIs can interfere with the regulation of blood pressure. Question 5. A patient diagnosed with depression is taking a monoamine oxidase inhibitor. Which medication should be immediately available for administration when the nurse is assessing the patient for a hypertensive crisis? A. Atenolol. B. Digoxin. C. Furosemide. D. Phentolamine. Correct answer, D. Phentolamine. A hypertensive crisis is a potentially life-threatening complication that can occur in patients taking a monoamine oxidase inhibitor, MAOI, especially when they consume foods high in tyramine or take certain medications that interact with the MAOI. This crisis results in a sudden and severe increase in blood pressure. Phentolamine is an alpha-adrenergic blocker that can quickly lower blood pressure and is used in the emergency treatment of a hypertensive crisis. It works by blocking the effects of the sympathetic nervous system on blood vessels, allowing them to dilate and reducing blood pressure. Question 6. A patient is admitted to the psychiatric unit for suicidal ideation. The physician prescribes escitalopram and asks the nurse to review the side effects with the patient. Which common side effect should the nurse include in the patient's education? A. Confusion. B. Constipation. C. Sexual dysfunction. D. Weight loss. Correct answer, C. Sexual dysfunction. Escitalopram is a selective serotonin reuptake inhibitor, SSRI, used to treat depression and anxiety. A common side effect of SSRIs, including escitalopram, is sexual dysfunction. This can include decreased libido, difficulty achieving orgasm, and erectile dysfunction. It is important for the nurse to inform the patient of this side effect, as it can impact treatment adherence and quality of life. Question 7. A patient on fluoxetine is hospitalized for serotonin syndrome. Which of the following symptoms should the nurse anticipate observing? A. Confusion and constipation. B. Hypotension and bradycardia. C. Hypotension and nausea. D. Tachycardia and myoclonic jerking. Correct answer, E. Tachycardia and myoclonic jerking. Serotonin syndrome is a potentially life-threatening condition that can occur with excessive serotonin activity, often due to the use of SSRIs like fluoxetine. Symptoms of serotonin syndrome typically include autonomic instability, e.g., tachycardia, hyperthermia, neuromuscular hyperactivity, e.g., myoclonic jerking, tremors, and altered mental status, e.g., confusion, agitation. The combination of tachycardia, increased heart rate, and myoclonic jerking, involuntary muscle jerks, are classic signs of serotonin syndrome. Question 8. A patient is prescribed sertraline for depression. Which of the following common side effects should the nurse include in the patient's education? A. Chills. B. Constipation. C. Tremor. D. Weight gain. Correct answer, C. Tremor. Sertraline is a selective serotonin reuptake inhibitor used to treat depression, anxiety, and other mood disorders. One common side effect of SSRIs, including sertraline, is tremor. These tremors are usually mild and can occur in the hands, particularly when starting treatment or adjusting the dose. Question 9. A patient who has been on paroxetine for 8 months reports experiencing sexual dysfunction and intends to stop the medication because of the side effects. What is the most appropriate response from the nurse? A. Advise against stopping the medication abruptly due to potential withdrawal effects. B. Support discontinuation to strengthen the nurse-patient relationship. C. Contact the physician right away. D. Empower the patient by encouraging them to stop the medication on their own. Correct answer A. Advise against stopping the medication abruptly due to potential withdrawal effects. Stopping paroxetine abruptly can cause withdrawal symptoms. The nurse should advise the patient to gradually taper off under a healthcare provider's guidance to avoid these effects and explore alternative options for managing sexual dysfunction. Question 10. Which of the following should a patient prescribed citalopram be advised to avoid? A. All over-the-counter medications. B. Alcohol. C. Dark leafy greens. D. Insulin. Correct answer B. Alcohol. Citalopram is a selective serotonin reuptake inhibitor commonly prescribed for depression and anxiety. One of the key patient education points for citalopram is to avoid alcohol. Alcohol can enhance the sedative effects of citalopram, increasing the risk of drowsiness, dizziness, and impaired judgment. It can also worsen the side effects of the medication and potentially increase the risk of serotonin syndrome, a rare but serious condition. Question 11. A patient is given chlorpromazine for acute psychosis. Which potential side effect should the nurse monitor for? A. Cerebral edema. B. Hypertensive crisis. C. Serotonin syndrome. D. Tardive dyskinesia. Correct answer D. Tardive dyskinesia. Chlorpromazine, a typical antipsychotic, can cause tardive dyskinesia, a condition involving involuntary, repetitive movements, especially with long-term use. This is a known side effect of typical antipsychotics. Question 12. A patient is prescribed zolpidem for the treatment of insomnia. Which instruction should the nurse provide? A. Avoid driving or operating machinery after taking this medication. B. Take another dose if you awaken during the night. C. Take this medication 2 hours before bedtime. D. Take this medication with a glass of wine. Correct answer A. Avoid driving or operating machinery after taking this medication. Zolpidem can cause drowsiness and impaired coordination, so patients should avoid activities that require full alertness, like driving or operating machinery after taking the medication. Question 13. A nurse is providing medication teaching to a patient who has been prescribed trazodone for depression. Knowing that sedation is the most common side effect of this medication, which instruction should the nurse provide to the patient regarding medication administration? A. Take the medication before bedtime. B. Take the medication with a full glass of milk. C. Take the medication with an antacid. D. Take the medication with food. Correct answer A. Take the medication before bedtime. Trazodone commonly causes sedation and drowsiness as a side effect. By taking it before bedtime, patients can minimize the impact of this side effect on their daily activities and potentially use the sedating properties to help with sleep. Question 14. A 14-year-old is prescribed methylphenidate for the treatment of attention deficit hyperactivity disorder. The nurse is educating the patient about potential side effects. Which of the following should the nurse include? A. Constipation. B. Insomnia. C. Sedation. D. Urinary retention. Correct answer B. Insomnia. Methylphenidate is a stimulant, and its most common side effects are insomnia and nervousness. Additional side effects may include gastrointestinal discomfort, nausea, loss of appetite, arrhythmias, sweating, palpitations, and dizziness. Question 15. A confused patient is being admitted to the hospital, and the nurse is gathering his health history. The patient denies having any diseases but mentions discontinuing donepezil. The nurse understands that donepezil is prescribed to treat which of the following? A. Alzheimer's disease. B. Bipolar disorder. C. Parkinson's disease. D. Schizophrenia. Correct answer A. Alzheimer's disease. Donepezil is a cholinesterase inhibitor commonly prescribed to treat Alzheimer's disease. It works by increasing the levels of acetylcholine, a neurotransmitter involved in memory and learning, which helps improve symptoms related to memory and cognitive function in people with Alzheimer's disease. Question 16. The nurse is providing instructions to a patient taking a monoamine oxidase inhibitor for depression. Which of the following precautions should the nurse include? A. Avoid caffeine and cheese. B. Only walk with help from another person. C. Take the medication with a full 8-ounce glass of milk. D. Wear incontinence pads. Correct answer A. Avoid caffeine and cheese. Monoamine oxidase inhibitors, MAOIs, are a class of antidepressants that require specific dietary restrictions due to the risk of hypertensive crisis. MAOIs inhibit the breakdown of tyramine, a substance found in certain foods, leading to potentially dangerous increases in blood pressure if consumed in large amounts. Foods like aged cheeses and caffeine, found in coffee, tea, and chocolate, contain high levels of tyramine and should be avoided by patients on MAOIs. Question 17. A patient with congestive heart failure is prescribed lisinopril 10 mg PO daily. Which common side effect should the nurse inform the patient about? A. Confusion. B. Dry cough. C. Dry eyes. D. Weight gain. Correct answer B. Dry cough. Lisinopril is an AC inhibitor, angiotensin-converting enzyme inhibitor, used to treat conditions like congestive heart failure and hypertension. One of the common side effects of AC inhibitors, including lisinopril, is a dry cough. This occurs due to the accumulation of bradykinin, a substance that can irritate the airways and cause a persistent cough in some patients. Question 18. A patient is admitted to the psychiatric unit for acute agitation and anxiety. The physician orders a long-acting benzodiazepine. Which of the following medications does the nurse expect to administer? A. Clonazepam. B. Diazepam. C. Lorazepam. D. Midazolam. Correct answer A. Clonazepam. Diazepam is a long-acting benzodiazepine with a quick onset, making it ideal for treating anxiety and sedation. Clonazepam is longer-acting but slower, while midazolam is short-acting and lorazepam is intermediate-acting. Benzodiazepines work as GABA agonists, enhancing the effects of GABA, the brain's main inhibitory neurotransmitter. Question 19. A nurse is gathering health history information from a patient. The patient says she takes buspirone but does not know why. The nurse should educate the patient that this drug is used to treat which of the following? A. Anxiety. B. Bipolar disorder. C. Schizophrenia. D. Suicidal ideation. Correct answer A. Anxiety. Buspirone is an anxiolytic medication commonly prescribed for the treatment of generalized anxiety disorder. It works by affecting certain neurotransmitters in the brain, such as serotonin and dopamine, to help reduce symptoms of anxiety. It is non-sedating and does not carry the risk of dependency that other anti-anxiety medications, like benzodiazepines, may have. Question 20. A patient with depression is seeking help with smoking cessation. Which antidepressant is the physician most likely to prescribe, and it also aids in quitting smoking? A. Bupropion. B. Mirtazapine. C. Nefazodone. D. trazodone. Correct answer A. Bupropion. Bupropion is an antidepressant that is often prescribed to help with smoking cessation in addition to treating depression. It works by affecting the dopamine and norepinephrine systems in the brain, which helps reduce cravings and withdrawal symptoms associated with quitting smoking. Bupropion is marketed under the brand name Zybon for smoking cessation.